Hello everyone. This is image 10 of the Summer Radiology Interpretation course for the D3 students. In this video, we are going to review internal and external root resorption. We have one maxillary left canine radiograph. This radiograph was shared with me by Dr. Andrew Narnes, an endodontist and a graduate of the University of Minnesota. On this radiograph, we see an oval mixed density area. So what is this? The fun of radiology is that you get to investigate that are hidden inside the soft tissues, inside the bone, and to figure out what is bothering this sad tooth and also figure out what may happen in the future. Someday, I think I should wear this hat and come to the class. From the title of the video, you know that this is root resorption. But that's not it. We still have to figure out if the resorption is internal or external. If external, is it from the labial or the palatal aspect? Since I can see the outline of the pulp canal, it's less likely to be an internal resorption. However, the external resorption may also invade the pulp canal. At least one good thing is that the apical pedial space is within normal limits. To best analyze such a lesion, we have to find another tool in our detective shop. And that would be a small field of view, high-resolution CBCT scan. Luckily for us, Dr. Narnes has also provided with a CBCT scan. Let's review that. So on this CBCT scan, we have central incisor, lateral incisor, and the canine. So this is the tooth of our interest. This blue line, vertical blue line, indicates the image on this screen. So this is the labial surface of the tooth. This is the palatal. And you can see that the pulp canal is slightly irregular. So if I scroll through, and you can see that there's some defect. Here is the defect. And as I go distally, here is the resorption process. The interesting finding is that this cortical plate has pushed in osteoid material inside the tooth. So this is an external resorption invading almost to the pulp canal. As we have seen on the periapical radiograph, the apical pedial space is within normal limits. On the axial view, here is the area of resorption. And you can appreciate that the resorption is on the distal as well as on the mesial. Most of the resorption is on the palatal surface. So what is internal resorption? Internal resorption starts from the cells originating from the pulp. This is relatively rare, and there are two broad types of internal resorption. One is inflammatory and the other is replacement. External root resorption, the cells are originating from the pedial space. This is very common. Almost everyone has it, which means probably you have, probably I have, and I don't really like it. Average 16 teeth are affected per person, so that's even worse. There are two types. One is the cervical and one is the apical. Most of the root resorption is the apical type. One classification of invasive cervical resorption was published by Heithersay, and there are 4 different types, class 1 to class 4. In class 1, you have a small invasive resorption near the cervical area and into the dentin. In class 2, the lesion is into the coronal pulp chamber with little bit into the dentin. Class 3 is a deep invasion into the coronal dentin and also the coronal third of the root. Class 4 is extensive. It has extended beyond the coronal third of the root. There are several conditions that can lead to external root resorption. Common one is periapical pathology. Trauma may also cause external root resorption. Mechanical forces such as orthodontic treatment may cause external root resorption. Frequently, tumors and cysts will cause root resorption. An impacted tooth can resorb another tooth, or the impacted tooth itself may undergo root resorption. Osteosclerosis may cause root resorption. And then we have idiopathic root resorption that we don't know why the tooth is resorbing. Thank you very much, and I'll see you again on a different video.